episode 7 of our series on appliances that we've been following over these last few days. The appliance I'm going to present today in our episode 7 is one quite commonly used in interceptive orthodontics, and it can be used on its own or also in conjunction with other appliances. Let's get to know it. Fixed palatal grid. What are the essential tips about this appliance? It's very important to note that the fixed palatal grid is an appliance used to treat anterior open bite in patients who have a sucking habit or in patients who have already stopped the habit but still have an anterior open bite. I always recommend that if the patient is at the beginning of mixed dentition, place the loop band on the second deciduous molars and extend this framework to the first permanent molars. That way you'll have less tip rent. In other words, the tongue will put pressure on the area of the trap, but it won't cause the appliance to become unstable. Notice that in the clinical part, we place resin on the posterior section to increase stability. And always, it's very important that this trap extends just a little past the middle of the lower incisors. This way, I can ensure that the tongue won't go past the trap area. After I close the patient's bite, I usually leave it for a period of 3 to 4 months or more. This allows time for the tongue to adapt to its new position, where the tip of the tongue should rest on the patient's incisive papilla. It's a versatile appliance and should be used in your practice.